This Docs on Call is presented by Excellus Blue Cross Blue Shield and UHS. I'm here with Dr. Frank Floyd with UHS Primary Care in Enwell to talk about diabetes. Right out of the gate, what is diabetes?
Diabetes is an elevated blood sugar level. We call sugar glucose medically. The hallmark of diabetes is that the body does not produce enough insulin to bring the blood sugar level back down to normal.
And when someone is diabetic, how do you know it's controlled?
There are several ways you can tell control of diabetes. Commonly used methods are the finger stick test, where the patient pricks their finger, and that tells you what their blood sugar is at that instant in time. Another test that we use medically and rely on heavily is called the hemoglobin A1C test.
What is hemoglobin A1C?
Hemoglobin A1C refers to the amount of blood glucose, again sugar, that's bound to the hemoglobin inside the red blood cells. And again, the usefulness of that test is whereas blood sugars just tell you what it is at one point in time, the A1C test tells you how your blood sugars have been running over approximately a 3-month time frame.
So what is good A1C?
Good A1C varies. Good A1C can vary depending on the person's age and on their overall health. Patients that are young diabetics and patients that are healthy, we generally like to see their A1C less than 7. Patients that are older, that are more prone to hypoglycemia, that have more health problems, we will accept A1Cs generally up to 9, sometimes even higher, because we really want to avoid patients getting low blood sugar or hypoglycemia.
And why is control with A1C important?
Well, control of diabetes is important for a number of reasons, but the biggest reason why is that as the longer that you're diabetic and the worse the control of your diabetes, there's an increased risk of complications. And the main 3 that have been most identified with poor control of diabetes are blindness, kidney failure, and painful nerve damage.
All right, some great information again. Thank you, Dr. Frank Floyd with UHS Primary Care. And if you want more information, go to our website, wbng.com. If you want to leave a comment or question, call 584-7362, 584-7-DOC.